My name is Shoma Sullivan from Block C, Health Assessment for Practical Nursing, and this is my final video, head to toe assessment. Before I begin, I will do a 360 view of the room. Alright, so before I begin, I'm going to perform hand hygiene and don a pair of gloves. Now I will take an alcoholic wipe to wipe my stethoscope. Alright, and I'll begin the patient introduction. Hello, Mr. Smith. My name is Shoma Sullivan. I'm a student nurse here at the Etobicoke General Hospital, and today we're doing a head to toe assessment. Is that okay?
Yeah.
Alright, perfect. Can I please see your ID, ma'am? And please confirm your first and last name
John Smith,
and your date of birth.
1st of April 1973.
Thank you. Are you comfortable? Please use the restroom.
No.
I will now pull back the curtain and begin the assessment. So for physical appearance, patient looks as age stated. For skin color matches patient's genetic background. For body structure, can you please stand up? Alright, you may sit back down. Patient's height is within normal range. Nutrition, there's an even distribution of body fat. For body symmetry, all body parts are even bilaterally and there are no seen deformities. And for position, patient sitting upright in the chair with the arms in the lap. Now I move on to behavior. Patient is able to maintain eye contact with me at all times. Patient's speech is clear and comprehensible. For patient's dressed appropriately for the situation and clothes are well fitted. Personal hygiene, patient is clean and groomed. Now I move on to mobility. For mobility, I'm going to ask you to stand up and walk to the side of the room and come back. Alright, so for patient's gait, it was smooth and balanced with a symmetrical arm swing. And for range of motion, I'm going to ask you to flex your arms, extend your arms. Alright, perfect. So for range of motion, there was accurate and synchronized range of motion. Now we're going to move on to work of breathing. For work of breathing, patient is breathing effortlessly with no signs of distress. For level of consciousness, patient is alert and shows no signs of sluggishness. We're now going to move on to orientation. I'm going to ask you 3 questions. What is your name?
John Smith,
Alright, where are you today?
Etobicoke General Hospital,
And what is the date?
12th of April 2001.
Alright, perfect. So there was no signs of confusion when answering these questions. Now we're going to move on to the inspecting and palpating portion of the examination, starting with the head. So as I inspect the head, there are no felt lumps, there are no lesions, there's no swelling as I palpate. Is there any tenderness or pain? Is there any tenderness or pain?
No.
Alright, and there's an even distribution of hair and there were no seen infestations. Now we're going to move on to inspecting and palpating the facial structures. So as I inspect the facial structures, skin color matches patient's genetic background. There's no scars, there's no lesions, and there's no involuntary movement. Now I'm going to move on to palpating the facial structures. Is there any tenderness or pain?
No.
Again, any tenderness or pain?
No.
Alright, perfect. Now I'm going to move on to testing cranial nerve number 7. I'm going to ask you to smile with teeth, smile without teeth. Alright, I'm going to ask you to frown. I'm going to ask you to raise your eyebrows. I'm going to ask you to tightly shut your eyes and now puff out your cheeks. Alright, perfect. Now we're going to be moving on to inspecting the eyes. As I inspect the eyes, there's no crusting, there's no discharge. The eyes are symmetrical and there's an even lash distribution. I'm now going to move on to testing ocular motor number 3. I'm going to be looking at the pupil size. So for the pupil size, on this side, it's 5 mm. On this side, it's also 5 mm. Pupils are rounded, and the pupils for symmetry, they're even bilaterally on both sides. Now I'm going to move on to testing direct and consensual light reflex. So for direct light reflex, the eyes are constricting, and for consensual light reflex, the eyes are also constricting. Now I'm going to move on to testing for accommodation. So I'm going to ask you to look at the tip of my light for me. Alright, now continue to look. Alright, perfect. So for accommodation, the eyes are dilated, and as I move in, the eyes focalize. We're now going to move on to inspecting the ears. So for the ears are symmetrical and there's no discharge. I'm now going to palpate the tragus and auricle for any signs of tenderness. Is there any tenderness?
No.
Alright, again, any tenderness?
No.
Alright, perfect. Now we're going to move on to the whisper test. I'm going to whisper 3 words into each side of your ears. I'm going to repeat them back to me, okay?
Have a fever. Fever plastic.
Perfect. Now we're going to move on to inspecting the nose. The nose is midline and there is no discharge. I'm now going to palpate the maxillary and frontal sinuses. So for the frontal sinuses, are there any pain or tenderness?
No.
Alright, and now for the maxillary sinus, any pain or tenderness?
No.
Alright, perfect. Now we're going to move on to inspecting the mouth. So as I inspect the mouth, I'm going to start with the lips. The lips are hydrated and there is no swelling, and I'm going to ask you to open up for me. Alright, the gums are pink in color. There is no bleeding. The teeth are evenly distributed and there is no looseness. The tongue is symmetrical and there's no signs of atrophy. I'm going to ask you to take the tip of your tongue and touch the top of your mouth for me. Alright, perfect. So the base of the tongue is hydrated and there's no lesion. And open up again for me. Alright, so the soft and hard palate are intact with no signs of lesions as well. We're now going to be testing cranial nerve number 9 and 10. This is your glossopharyngeal and vagus nerve. I'm going to ask you to open up and say ah. So when the patient says ah, the uvula and soft palate are rising up and backwards. This means that the cranial nerve number 9 and 10 are intact and working correctly. We're now going to move on to testing cranial nerve number 12. This is your hypoglossal nerve. So I'm going to ask you to open up again. Alright, perfect. So the tongue is midline, and ask you to move your tongue from side to side. Alright, and repeat the words light, tight, dynamite.
Light, tight, dynamite.
Perfect. So there's no signs of tremors. I'm now going to move on to inspecting the neck. So as I inspect the neck, the head position is centered and midline. There's no scars, there's no lesions, there's no seen deformities. I'm then going to move on to palpating the neck. As I palpate, is there any tenderness? Any pain?
No.
Alright, the temperature is warm and there are no visible masses. Now I'm going to move on to palpating the carotid arteries. So as I palpate, the gray strength is +2 and the rhythm is regular, and for the equality even bilaterally on both sides. We'll now be testing cranial nerve number 11, your spinal accessory. So I'm going to ask you to move your head side to side as I apply resistance. So to the right. Alright, now to the left. Alright, perfect. And now we do the same thing with your shoulders. I'm going to apply resistance and you're going to shrug your shoulders, okay? Alright, perfect. Now we're going to move on to inspecting the upper extremities. Can you please roll up your sleeves for me? Alright, as I inspect the upper extremities, there is no scars, there is no lesions, there is no involuntary movement, and there are no seen deformities. Alright, I'm then going to palpate the upper extremities. So as I palpate, there's no tenderness, no pain, there's no masses, no lesions, and the temperature is warm, and there is muscle bulk. Now I'm going to move on to inspecting the hands. You may pull down your sleeve. So I'm facing your hands. Alright, so the nails show no signs of lesions, and the nails are curved and smooth. We'll now move on to the range of motion activity. I'm going to ask you to stand up with me. Alright, and you're going to follow my motions, okay? So flex your fingers, extend your fingers, flex your wrist, extend your wrist, ulnar deviation, radial deviation. Alright, shrug your shoulders, flex your elbows, extend your elbows, pronation, supine, adduct your arms, abduct your arms. Alright, internal rotation, external rotation. Alright, you may sit down. So was there any pain when doing these activities? Perfect. So there was no altered range of motion and there was no signs of crepitus. Now we're going to move on to palpating the radial pulse for 1 minute. So 1 minute simultaneously. Alright, so the rate was at 60 beats per minute. The rhythm was regular, quality was strong, rate strength was +2, and the pulse size was equal bilateral. Now I'm going to move on to the grip test. I'm going to ask you to grip my fingers for me and squeeze. Perfect. So his grip was strong and even bilateral. Now we're going to move on to inspecting the lower extremities, okay? So as I inspect the lower extremities, There's no scars, there's no lesions, there's no involuntary movement, and skin color matches patient's genetic background. I'm then going to palpate the upper extremities. As I palpate, is there any tenderness?
No.
Any pain?
No.
Temperature is warm. There's no muscle bulk, and there's no involuntary movement. All right. So now I'm going to move on to palpating the tibialis pulse. So for the tibialis pulse, I'm going to palpate for 1 minute simultaneously. All right. So the rate was 60 beats per minute. The rhythm was regular. The quality was strong. There was a grade strength of +2, and it was equal bilateral. Now I'm going to palpate the dorsalis pulse, pedis pulse, for 1 minute. Alright, so the rate was 60 beats per minute. The rhythm was regular. The quality was a bit weaker and harder to palpate, and the grade strength was +1, and it was even bilateral. Now we're going to test his dorsiflexion and plantar flexion. So for your dorsiflexion, I'm going to apply resistance. So for dorsiflexion, all right, now plantar flexion. All right, perfect. So his dorsiflexion and plantar flexion were strong. I'm going to remove my gloves, perform hand hygiene, and move on to the next part of the assessment, which is assessing his posterior thorax. All right, can you please turn around and lift the back of your shirt? So as I inspect the posterior thorax, there is no scars, there's no lesions, there's no seam deformities, there's no masses, and there's no, involuntary movement, and it is symmetrical. I'm then going to palpate the posterior thorax. So as I palpate, is there any pain?
No.
Any tenderness?
No.
All right. Temperature is warm. There's no masses, and there is no swelling of any sort. Now I'm going to move on to oscillating the posterior thorax. Okay, breathe in for me. Out. In. 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 All right, perfect. You may pull down your shirt and turn around. So there was no crackling or wheezing in the lungs. Next, I'm going to do the anterior posterior ratio. So for the anterior posterior ratio, the anterior posterior ratio is a 1. The transfers are 2, making the anterior posterior ratio a 1 to 2 ratio. I'm then going to be oscillating the anterior thorax. So can you please lift the front of your shirt? Breathe in. Out. In. Out. In. Out. In. Out. In. In. Out. In. Out. In. Out. In. Out. In. Out. All right. So for the anterior posterior ratio, the rate was 14 breaths per minute. The rhythm was regular, and for the quality of respiration, they were even and effortless. Now we're going to move on to listening for the heart sounds, and I'm going to be oscillating for the heart sounds. Starting with the right sternal border, second intercostal space. This is your aortic valve. All right. Left sternal border, second intercostal space. This is your pulmonic valve. Left sternal border, third intercostal space. This is your Erb's point. Left sternal border, fifth intercostal space. This is your tricuspid. And left midclavicular, fifth intercostal space. This is your mitral valve. Since I'm already at the mitral valve, I'm going to listen to the apical pulse for about 1 minute. Alright, perfect. So the rate was 80 beats per minute. There was no extra heart sounds. For the S1 and S2 sounds, the S1 sounds are best heard at the apex of the heart, and this is where your mitral valve and your tricuspid valves are. And your S2 sounds are best heard at the base of the heart. This is where your pulmonic and aortic valve are. So I'm going to ask you to please lay on the bed. Alright, perfect. So I'm then going to inspect the abdomen. So as I inspect the abdomen, there's no scars, there's no lesions, there's no visible masses, there's no pulsations, and the abdomen is symmetrical. I'm then going to oscillate the abdomen in the 4 quadrants just to listen to his bowel sounds. Starting with the right lower, right upper, left lower, and left upper. Alright, perfect. So there were the bowel sounds are hyperactive, and there were gurgling sounds, and this means that his bowel, there were gurgling sounds in all 4 quadrants of the bowel. This means that his bowels are working correctly. Now I'm going to move on to palpating the 4 quadrants of the bowel for any tenderness or pain. Alright, so starting with the right lower, any tenderness,
No.
any pain,
No.
no superficial masses, and on the right upper, tenderness,
No.
pain,
No.
no superficial masses, left lower, any tenderness,
No.
any pain,
No.
no superficial masses, and left upper, any tenderness,
No.
any pain,
No.
no superficial masses. Now we're going to palpate for the bladder. So we're going to look for any tenderness or any discomfort. So is there any tenderness,
No.
any pain,
No.
is there any discomfort?
No.
Alright, perfect. And there's no distinction. So this is the end of the assessment. Thank you, Mr. Smith, for your time.